Hi, I'm Dr. Jerry Hesch. I am a orthopedic manual physical therapist, and I've had an interest in seating all of my adult life. When I was in college, I used to sit on a book to raise my hips higher than my knees. And in my car, I had a bucket seat, so we're gonna make a mock bucket seat. So we're gonna put the front legs on this thing, and so you can see that the seat pan leans backwards. And so I had a Datsun for a number of years, and it had bucket seats, and it was most uncomfortable. And I'm uncomfortable right here. So I did two things. One thing, it's very simple, is that you can roll a towel about 3-inch diameter, and you can place it in the corner of the seat pan and the back of the seat. What does that do? Well, it actually rolls my pelvis forward. Okay, the pelvis has a profound influence on the angle of the hip and also on the lumbar spine. When I have this behind my pelvis, it's really easy for me to alter my posture. So if I'm driving 4 hours, which was from where my parents' house to where I went to university, that's a long drive to be sitting in a bad posture. So simply adding that allows me to modify my pelvic posture quite easily. And you'll notice now it's very constrained. Okay, so I also played with a seat wedge, and that will somewhat flatten the seat pan out. Much nicer, much nicer. You do see advertisements for a lumbar roll, but they're so counterintuitive to me that sticking something in there to alter the angle of the lumbar spine without giving consideration to the height of the seat pan makes no sense. So I'm going to back it up a little bit and say that one of the most important things for sitting is the height of the seat surface, okay? And you'll see on this computer here, we're a little bit crowded here, but go ahead and come closer, Karen. And you oftentimes see ergonomic advice here, and this shows a 90-degree angle of the hips and knees. All right? Now, if you'll back up and film me in my office chair, I am sitting on a pad to raise it about an inch, and I purchased a taller gas cylinder so that the seat pan can raise up. My hips are higher than my knees, and therefore, without any lumbar support, it's so easy for me to change my posture. So when I tell clients, if they're going to purchase a chair, I tell them one of the most important things is to be able to get your hips higher than your knees, and sometimes you have to buy a taller gas cylinder. This was a very top of the line chair back in the day, and you can read so much more about ideal chairs and such, the angle of your eyes with the computer screen, etc., etc. But I want to keep this very simple and just focus mostly on real simple modifications you can do, particularly in the angle of the seat. Well, when I went to physical therapy school in 1979, 80, 81, I had to do a senior project, and I did this. I developed a wedge, and I evaluated sitting comfort and found that the wedge did create more sitting comfort. And of course, everyone thought I was crazy, and they thought, well, what does this have to do with physical therapy? My answer is everything. We treat patients with back pain, oftentimes of unknown cause, and the seat might be part of the problem that leads to back pain. 50% of women in one study had discomfort at the tailbone when it was touched. and they did not even know that they had discomfort. Okay, I'll show you a few more simple modifications. So this is similar to a gardener's kneel pad, and you can place it at the front of the chair. My sit bones are going to actually hang off of it, so they are going to get less compression, and I still accomplish hips being higher than knees. Okay, the best posture is one that lets you change and achieve another posture easily. Okay, lots of devices out there. Sitting on an exercise ball can be very comfortable, very easy to change your posture. There's all kinds of chairs on the market, but I want to say that in my opinion, my experience, to be able to change the posture of your pelvis is the most fundamental issue. Some of us, in fact, 30% of the population has developmental asymmetry of the pelvic bones or of the hips. Okay, I'm one of those people. So there's no amount of therapy that's going to change my bones, right? There's no way to change that through exercise or stretching or any of that. The height of one half of the pelvis versus the other is based on bony development that stopped when I was about 25. Okay, so when I'm all done treating my clients and optimizing their posture, strength, muscle length, all of that stuff, I then test them in sitting. When I sit in this chair, this thigh is higher than this one. And there is a very simple, very inexpensive solution. And I think that as physical therapists, we should try this with all of our clients. And it's surprising what a little difference can make a big difference in their sitting comfort. So this is a piece of craft foam, and you can buy it about that big, about the size of a piece of paper, and you can cut it twice. You'll have 4 pieces, okay? So by putting this 5 millimeter, which is just under 1/4 of an inch, under that left sit bone, all of a sudden I feel like I'm sitting more comfortably. I feel like my posture is appropriate. So the foam supports my uneven pelvis instead of trying to force it into symmetry. I had one patient spontaneously note that he had greater neck rotation when he was sitting on the foam versus when he's not, and that's true for me as well. So this is a very inexpensive piece of foam, and it can be very helpful. So the purpose was to demonstrate some simple things that can be done to optimize sitting comfort. And I think this is additive to the knowledge base out there, and I hope it helps you. Thank you.